But yes, thank you for joining us for this webinar, Ethics, Equity and Budgeting in Public Involvement. This is the second webinar of a short webinar series funded by the NIHR Children's Health and Maternity Programme. We will be bringing up some sensitive topics today, so please look after yourself, look after each other, do whatever you need to do to feel comfortable. So I'm Naomi Morley. I'm a researcher at the University of Exeter, and I work in the Patient and Public Involvement team for the Applied Research Collaboration, Southwest Peninsula. I am working on the Children's Health and Maternity Programme, and this is where I've met Mary in a community of practice. With that, I'm going to hand over to Mary. Mary, do you want to introduce yourself?
Lovely. Thanks so much, Naomi, and welcome to all of you here. It's been amazing to see how popular these webinars are, and it very much reinforces the view that we had that there was a gap and a need for opportunities for people to come together as a community of practice. Those of us who are working in the area of public involvement in research and doing it through the Programme for Child Health and Maternity seemed like a really good place to develop this work and to see what the demand was and what we can learn from doing these 3 webinars. So thank you for coming on the journey with us, and we're really keen to have your thoughts and what you'd like to happen next, hear what you want to happen next. So it's very much for people who are representing service users and communities, for people from that perspective who are involved in leading public involvement, perhaps as a co-applicant, perhaps with an executive role, and for professionals who've made it their business to really specialise in public involvement. And we've all got different insights, and we can, I'm sure, by working together, be more than the sum of the parts. So in South London, the maternity and perinatal mental health theme, we have a public involvement strategy group once a year. And one of the things that came out of a discussion on capacity building last year was very much that we needed better sources of information and support. Hence my getting in touch with Naomi, and we've set up these webinars. And so we do want to find out what other people's feelings are and take it from there. Thank you.
Thank you, Mary. So why this topic today? We have shaped the webinars from the needs and conversation that we had with different community of practices around public involvement. And one of these conversations was around that health research often involves careful planning and considerations of people's values and backgrounds and barriers to conduct ethical research. But although there's a lot of conversation about doing research, we know much less about sort of the pragmatic factors of involving public partners in a way that is safe, whilst also acknowledging their right to be heard. So that's not always straightforward, and sometimes that doesn't seem equitable, where we have to strike hard balances between procedures that are supposed to keep people safe and inclusive involvement. So to answer that, the answer can't always be simply to chuck more funding at it. The pockets aren't bottomless, and I certainly don't have all the answers, but we hope that today we can highlight some of these islands of good practice, and hope that this is an opportunity exploring some of these challenges and solutions together. So let me hand over back to Mary, who has just spoken to you, and also Agnes Agyepong, who is the founder and CEO of Global Black Maternal Health and founder of GloMama Awards. And I'm going to be sharing my screen for you.
So Agnes and I are going to be talking to you about involving diverse communities in research, and to share with you some insights and learning from a co-produced training event that we ran in South London. My colleague, Dr. Abigail Easter, sadly can't be with us today as she's had to take some leave unexpectedly. So I'm going to be sharing the part of the presentation that initially she presented. We developed this presentation together, and we first gave it to when we'd completed the project at the end of 2021. So I'm talking, the work that I'm sharing, it comes from the maternity and perinatal mental health theme at ARC South London. All that I'm talking about with Agnes today has been published in the report that you can see here. And later when I finish speaking, I will put that link into the chat so you can look it up and find out more if you'd like to. So just a little bit of background about our theme. It's all about looking at current issues for those undertaking the maternity journey in South London, but a lot of our focus is in South East London, where there are higher levels of deprivation and a very diverse community. And we're focusing on poorer outcomes for women and babies living in areas of social disadvantage, those with mental health difficulties, and ethnic diversity. And we're asking, why do those social groups have poorer health outcomes, and what models of care can help? And we have done some research on the impact for those groups of COVID-19. The focus is very much on reducing how we can reduce health inequalities through research for local communities, and involving women in communities and relevant organisations is a core part of the strategy. We're very fortunate to be superbly well supported by the communications team at South London, and projects that are being planned, that are underway, and when they're at the stage of reporting results are flagged and made very clear and accessible through blogs referring to published papers and other outputs. That applies to PPIE work as well. We're very fortunate in that regard. So we first initiated our public involvement work for the ARC back in 2020. And it was just the time that the COVID pandemic, that spring when COVID was raging, and none of us knew how long it was going to go on for or what an impact it would have on our personal and our professional lives. But we decided that we needed to go ahead and get the public involvement underway, and that we planned 2 online meetings, which was a real new medium for us at the time, because we'd done everything face-to-face and valued those opportunities. We held one at lunchtime and one in the evening, and it was really interesting that both were equally supported. Different times of day worked well for different people, and that's a lesson in itself. We need to be flexible, we need to be responsive, and our aim is to include service users, networks, communities, charities, to build on our existing connections, to constantly be building new connections using social media and through people who know communities. And one of the groups we work with and invite into our discussions are maternity voices partnerships throughout London, now maternity and neonatal voices partnerships. So over to you, Agnes.
But first of all, thank you everyone for having me. So the next few slides, I'm going to talk about why Black women are not engaging in research and what can be done to change this. So as Mary kind of contextualized earlier on, this whole piece of work came out of COVID, Black Lives Matter movement. There's so much going on during that kind of 2020, 2021. And I was a patient public involvement contributor on some of the perinatal mental health theme. And I just wanted to kind of just caveat when we're talking about what does relational research looks like when we're talking about public engagement, and that's kind of where this really stems from. So what happened in 2021? Was it 2020 now? I'm actually getting the dates muddled up, but I basically wrote an article, and it's really important when we look at how do we involve the public in research in a way that's equitable. I really like the way that theme was kind of set out in the beginning, because that's exactly what happened to me, the long and short of it. So I wrote an article, the Serve on the Right for National Institute of Health Research, which actually Mary and Jane had offered me the opportunity. And they said, look, they've got a small budget, but would you like to write about something that you would want to write about? Would you like to write about research in maternity and perinatal? And I thought about it and I said, okay. So I set about, and this is my one claim to fame. It went a little bit viral in the kind of NIHR world. None of my friends and family outside of that kind of arena understood why I was getting excited. But I think that's really, really important, because when we're involved in the public, oftentimes we only think about the Amazon vouchers, or we only think about the monetary kind of transactional approach. Somebody else is joining and now we are going to pay them. But actually, there's so many other things that you can do to offer service users or the public, ways of getting involved in a way that amplifies their voices, and actually they might find it really useful. And I say that because once I wrote this article, other opportunities came about. I wrote another article that ended up on the front page of Nurse Researcher about bias, and so many things cascaded of that one different opportunity. So I think the key point that I want to make out of that is, when we're thinking about how we're bringing in the public, we need to be thinking about what is the kind of shopping basket, the different options that we can actually offer people. And some of them, sometimes when we're in the research world, we don't actually realize that there's value in some of the other stuff that we're doing. So I really want to kind of put that out there about offering that aspect. But also, again, what were some of the key themes? Why did it get so popular? Because we were talking about typically when we're talking about research, there is a reason, and we saw this in the COVID-19 pandemic. We've seen it for hundreds and hundreds of years, but COVID-19 really brought this to the forefront. There's a lack of trust oftentimes within communities, within marginalized communities. I'm talking about Black women, but we can say in most marginalized communities within the UK, and I would probably say even in America as well, there's often a lack of trust within the research. So the questions I always like to kind of put out there for any kind of budding researcher or anybody that's interested in doing PPI work or trying to really engage is to really ask yourself some key questions throughout your research work. So question number one, are our leadership teams reflective of the types of audiences we are trying to reach? This is really important. I remember when Trump was in office and there was this whole health equity summit. I think there was a new bill that was being put out. And all of the people sitting on that table were all middle-aged white men talking about women's health. And, that went viral. It was like, well, how can they be talking about women's health? And there's no women even on the board. There's not even one. But oftentimes that's how we see that when we're from marginalized communities and people are saying, actually, we want to help, we want to reduce inequalities and we want to do research. Well, actually, we're not really seeing ourselves reflected in those research teams. So it's really important to see how can we bring people in and create leadership teams that are quite diverse. Particularly, and I'll extrapolate this work. So if I've said, what Black researchers are we working with for this project? But it could be, what Roma Gypsy researchers are we working with on this project? Whatever the kind of target audience that you're trying to reach, ask yourself, do we have somebody from the community that is also supporting us? Because there's nuance in research. Research is not just data. There's the interpretation of that data. Even I would go to say that you need to be asking yourself these questions even when you have an idea of what it is that you're trying to research. Because oftentimes, we see it all the time, we start off thinking we know what we want to research, but actually, if we'd only asked the very people the right questions in the beginning, it would have saved us a lot of headache. What Black networks are we reaching out to and co-producing them? We don't need to reinvent the wheel. There are so many different community groups that are out there doing the work within the community, that have got the access to the community, that have got the trust and so forth. So I always say, how are you building relationships with these kind of key leaders and decision makers? A really important part, are we funding our partners adequately? I can't stress the amount of times I've seen kind of PPI or kind of service user engagement seen as an afterthought. So the funding application has gone out, all of the work has kind of halfway there, but it's like, oh, actually, we need to now find money to pay, the people that we want to support us on this work, but we didn't put that in the application, so we now don't have the money. So we're thinking about this from the very beginning, then we can kind of avoid some of those pitfalls. Is our approach transactional or relationship led? And I think that's one of the key important points. Mary can message me anytime, and she knows I'm going to try and squeeze it in if my diary permits. But that is because, yes, I was part of this kind of the steering group from the beginning as a kind of a PPI. But it's more than that. It's become a relational relationship. I know that's a bit of a tongue twister there, but it's become more of a relationship. So it's not a transactional approach. It's not, okay, I'm just going to give you this and do that for me. In the short term, yes, I might be like, oh, well, actually, I need that. Christmas is coming up. Maybe I will need some of those Amazon vouchers or whatever that may be. But actually, if we're trying to really build system change, we need to be building that relational approach. And when you have a relationship, you have trust. You have all the different pitfalls that we often see researchers falling into. It can alleviate. Relationships do take time to build. So there's a little bit of an investment to build authentic and genuine relationships. But in the medium to long term, it saves you so much time. So really be thinking about how are we actually building relationships that do not seem transactional or exploitative, but actually are empowering to the community and empowering to yourself. And I would say actually, giving me the opportunity to just write, not knowing if I could write or not, and giving me that opportunity, I felt really seen. I felt like, wow, this is not just about coming in and the funding pot that's there to support me, and it's just about that. I felt like, oh, actually, this group of people actually really care about my kind of long-term aims and objectives, and they're helping me to achieve my goals. So it became a relationship for me. And how we collaborating with and amplifying the voices of those who are already doing the grassroots work within the community. Again, another key point, and I'll end that there. But I say that because imagine if you've been doing all of this work already in the community, being undersourced, underpaid, underseen, that's just not even being seen for the work that you're doing. And then you get some researchers who said, oh, let's actually go and do that work, and you just come into the community. That can already create some hostility, even though you may not even know the nuances of what's going on. So I think it's really, really important to try and see if you can identify, are there some people who may not be doing exactly what it is that you want to do, but within a similar vein, and seeing how can we onboard people who are already doing that grassroots work. Thank you.
Thank you so much, Agnes. That's so inspiring. Brilliant. Thank you. So I'm just, we had, as Agnes has said, she wrote a blog for us about the Black community and relationships with researchers. And then we discussed it at an advisory group meeting, and we decided it would be a really good thing to co-produce some training for researchers and service users jointly. And we used participatory appraisal methodology led by Emily Ahmed, pictured here with the orange post-its next to her. And our questions were, how can researchers work with diverse communities? How can we share power? And how can we overcome barriers to public involvement within research systems and cultures? And it was co-produced by Vita, who's on the call, and Catherine, pictured on the bottom right. We haven't yet managed to see a picture of you, Agnes, but Agnes is here on this image with yellow post-it notes. And that was just one page. We used an online whiteboard, a digital whiteboard called Jamboard. And that was a fantastic way of being able to work together online and co-produce. And we used it in anticipation when we were planning and got people on board in advance of the training event and then used it during the training. And it was great for interactive participatory activities. We had 3 talks, short talks at the beginning of our training, just as we're having 3 elements to this discussion today. So first, Abigail, who would have introduced this talk today, talked about the aims of the ARC Maternity and Perinatal Mental Health theme. Agnes talked about views from the Black community, and Emily then talked about the principles of participatory appraisal and the values that really underpin that. And tackling power inequality is an absolutely fundamental one. We used a range of techniques, and I'm just going to share 2 with you briefly. One of them is called a spider diagram, and it's a way of exploring barriers and potential solutions. We separated into 2 small groups to begin with, researchers in one and community members in another. And each group talked about the barriers to inclusion in research and equity and diversity. And then we swapped over, and each group made suggestions about potential solutions to the barriers that the other group had to come up with. And another activity we used, it was using the H form to focus and structure the discussion and to record it at the same time, which is so helpful for writing up afterwards. On the left, we talked about the don'ts. On the right, we talked about the do's, quite a focus on positives here, and then remaining questions are underneath. So I'm just going to report very briefly on themes of community focus, communications, funding, trust, power imbalance, and diversity. And these should go all the way through any piece of work like a stick of rock. So one of the participants said, we need to prioritise research questions that are important to local communities, not just driven by funding bodies. And so our recommended actions were things like ask the community what's important, budget for a PPI lead, think about reciprocity, and advocate for community-led research. Another said technical or formal language being used might work for ethics approval, and it might score highly for being respectful, but some of that language can seem quite distant and cold, and therefore for community members it may feel as though it's nothing to do with me, or indeed positively alienating. So some recommendations to make sure information is short and clear, to get community advice on communications, including getting them in at the beginning before documents go to ethics for approval, to plan outreach activities really carefully, including asking which social media platforms are the best ones to use to reach the groups you want to include. On money and funding, it came up, as Agnes has said, that not having the money to do things properly, not having resources, wanting to do things better but not being able to do it, came up as important. And so we need to plan PPI funding in detail and apply for it at the very beginning, making sure that all the work that we need to do is listed and gets funding, with a budget for team building and training being really important to bring everybody together and empower people. Also in the plenary discussion, it came up that we talk about trust being very, very important and providing information and representation at all levels of decision making. And so recommendations were to actively focus on being respectful and appreciative, to work together and ensure reciprocal benefits, to build trust with key community influencers, and because then it'll be cascade down, to support active development of research by community members, and to always and constantly ask, are we sharing power and what can we do differently? So that's our talk. Thank you very much. And big thanks to you, Agnes, the star of the show, and we can all see you now.
Thank you so much, both. There is so much food for thought there, and can I go straight over to Jill and Tanya, our next guest speakers. So Jill is a research clinician, clinical psychologist at the King's College London, and Tanya Sudeja is a public partner at the Applied Research Collaboration together with Mary in the Maternity and Perinatal Mental Health team.
Lovely, thank you. Yeah, just to say thanks for inviting us today. And I'm a participant as well as a speaker, and I've already been making quite a lot of notes on the first presentation, so thanks so much for that. So we entitled this talk Overcoming Challenges in Public Involvement, Learnings from the REVA study. So just very briefly to say that REVA's main question is, how can health IDVAs, which are independent domestic violence advocates, best be implemented in maternity services to improve outcomes for women and their children? I'm not going to really say much about REVA, but I wanted to put in what the question is.
Did it go okay?
Just note that this is a population that we're working with that have multiple vulnerabilities, and some of our public members have got lived experience that overlap with some of those vulnerabilities. So it's always kind of in our minds. But the aim of the talk today is a few things. One is to give an overview of our goals in involving public members in the REVA study. I'll talk a bit about what guided our thinking about how to do this, and I'll share some of the resources that we used. And then I'll talk about some of the key issues and challenges that we've come across and learned from, so that hopefully you can learn from some of them too. So I'll say a bit about that from my perspective as a researcher, and then I'll hand over to Tanya, who will say a bit about her experience of being a public member on the REVA study. So in terms of our aims in having PPI members in the project, we had two main goals. The first one, which probably overlaps with lots of other people's other research projects goals, was to have people as being sort of critical friends of the study, so supporting, challenging, advocating for the project, thinking about getting advice on the relevance and acceptability of the study questions and the study design, thinking about the management and oversight of the study in terms of keeping our goals focused and aligned on trauma-informed practice and practicing ethically, looking at our study materials and communications, thinking about inclusivity and accessibility, and then also on interpretation and dissemination of our findings, thinking about who we need to disseminate to and what we need to include. But our other goal, which may be different to some other people's projects, was also to have our PPI members as co-researchers on the study. We've very much been learning as we're going for this aspect of the study, and then there may be other roles that people take on, but so far that's included some of our members undertaking research interviews with service user participants. That involved us delivering some training that was about interview skills, but also about things like informed consent and confidentiality and so on. And then we've also included people in some of our papers. We've had one main output so far, the link to which is at the bottom of the screen, and I can put that in the chat later if it's helpful. And people have contributed in two different ways. Sometimes as authors to the paper, but we also included in the paper that I've put the link to a commentary by our members. So that was them free to have their voice to comment on the content of the paper, perhaps what was missing, perhaps what we weren't necessarily thinking about, perhaps where future research might need to pick up. And that was published alongside the journal article itself. So if you want to have a look at what that looked like and how that was done, do go and have a look there. So those were the two main roles that our PPI members have had. And when we were thinking about involvement and how it was going to be done and what we wanted to be thinking about, we drew on various different principles. So I guess the overarching ideas were around these principles of trauma-informed practice, which you might have come across in health services or other research contexts. And I guess these are really sort of thinking about ways of working that recognize that anybody can be affected by trauma, and then explicitly working to try and ensure safety and trust for people. So that includes things like physical and psychological safety. So thinking about the way that we approach meetings to help people feel that they can speak, that they're in a place where they can have their voice heard. Thinking about empowerment, choice, control, so options about how much people want to be involved, control over their time in that way, making sure that they know we're using their involvement in ways that impact on the project. Things around trustworthiness and transparency, so having real clarity about our expectations regarding people's time commitment and the tasks that they might be involved in. And again, being clear about how we're using that involvement and the impact that it's having. And then thinking about the collaboration and mutuality. So as far as possible, having a non-hierarchical structure in the way we work with people, and making sure that people feel heard and that they know their voice is as important as ours. We're all bringing different skills that all impact on the research equally. So those were our overarching principles. And then we also drew on the Survivors' Voices Charter called Turning Pain into Power. So as that name suggests, this is a charter for organisations engaging abuse survivors in project research and service development. Again, I can put a link to that charter in the chat afterwards if that's helpful, if you want to go and have a look. It gives some really nice principles about what to consider when you're working with people who are trauma survivors. And then we also drew on the research integrity framework on domestic violence and abuse that was developed by Women's Aid in the UK. So again, that's thinking about how to ensure ethical, safe practice and research and what you need to be holding in mind. And I'll share that link as well, so you guys can all draw on that if it's helpful. So that was kind of leading our thinking in terms of what are we going to be doing, how are we going to do it in a way that keeps people's voices at the centre, but also keeps people feeling safe and that they can say what they want to say, and ensure that the feedback that we're getting from people about the study is open and is listened to. So I'm going to move on then to thinking about how that actually worked in practice and what that looked like on the ground in terms of some of our research processes and also having people as co-researchers. And I was sort of thinking long and hard about these categories, and it was a bit hard to split things up into different areas, if you like. But I think these probably capture the main things that came up. So I'll just go through some of these and think about some of the challenges that we came across, some of the things that we had to consider, and some of the ways that we overcame that and are still learning from and overcoming, I guess. So sorry to start with governance and admin, but this has been a really big one actually, which perhaps we didn't anticipate. So this came up particularly for having our public members taking on roles as co-researchers, and particularly for undertaking interviews with some of our service user participants. So our participants were NHS patients, and anybody who has been involved in research in the NHS will know that there's a lot of processes you have to go through in order to be able to get access to NHS patients and collect data from them. So one of the key things there is having what's known as a research passport. I won't say too much about what that is, but it allows you to be able to go in and collect data in the NHS. And in order to get a research passport, first thing, it helps if you're employed by the university, which our public members weren't. And you also need some other documents, things like a CV and sometimes a DBS and occupational health clearance and those kinds of things. Just to note, one of my big learnings was that if you are only doing online interviews, actually you don't need the DBS and the occupational health clearance. So if others of you in the research world are thinking about supporting public members to do interviews, as long as they're online, the governance does reduce a little bit around that. But actually, you know, that did create some challenges for us in terms of time as researchers, as spending quite a lot of time trying to figure that out and who to talk to and how to set up associate contracts and things for people. But of course, also it puts somewhat of a burden on our members in terms of them needing to put together a CV if they didn't already have one, go through the process of DBS checks if they didn't already have one, you know, all the paperwork and bits of form filling that you have to do. So it required us to think about, you know, how much of that can I do, and how much of that needs to be done by our public members? How are we compensating people for their time going through those processes? Is this a good balance in terms of the burden on people and what they might actually be able to gain from that at the end, which of course you don't always know as you're going through it. But I think a key thing there is thinking about, you know, when you're thinking about people's job descriptions, including researchers' job descriptions, making sure that there is time available for people to really engage with this and do it properly. I suppose maybe the other thing is just thinking about whether people need support with some of those processes, maybe if English isn't their first language, or they don't know what the format of a CV should look like, making sure that those things are in place so that people can engage with it and don't feel excluded just because they don't have a CV or they haven't done that before. So that requires a bit of thinking about. Thinking about momentum and meaningfulness. And again, I was trying to think of what's the concepts that kind of capture some of the challenges. So momentum I talked about because I think it's important to make sure you keep ongoing contact with public members across the study, even in quiet times. So we only had sort of formal PPI meetings twice a year, I think, which isn't that often. So what was happening in between to help people still feel connected to the study? We had some really long delays in getting approvals from research sites to begin. So again, we were thinking about what can happen in between to keep people involved. Now, in fact, we filled that gap by doing the training for the interviews, which worked quite well. However, we then had a big gap before we were able to do the interviews. So again, thinking about keeping up those skills, some additional role plays and so on. In terms of the meaningfulness, I definitely wanted to keep that in because what we found was that our recruitment for service user participants was actually very slow and very difficult, and we haven't had that many. So all the training that we did, only a couple of our members have actually been able to put that into practice in terms of being able to do the interviews and use that training. So again, it's for us to think about how can we ensure that nevertheless the training feels like it's been useful, that people have got something out of that. Then even if we don't end up having many interviews, it still feels like a useful process. Maybe the other thing with the meaningfulness is making sure we feed back to people how their involvement has impacted on what we're doing. So if something that somebody has said in a meeting means we change our processes, having a robust feedback system to let people know about that so that people know what they're doing has impact and meaning and actually changes things. In terms of inclusivity in roles and language, we had multiple different opportunities for people to get involved with things, which included as co-researchers, which people could choose if they wanted to or not, and all our other tasks as well. You know, if people didn't have time to look over stuff, that was fine. We made sure it was really open and optional. But also I think it's really important, and again, I learned over time about being aware of barriers that people might have to being involved. So even if they want to be, there might be things that get in the way. So whether that's childcare, a lack of previous experience in particular tasks, neurodiversity, particular times of the day that work or don't work. So really trying to keep on top of that and ensure that we reduce those barriers as much as possible so people have genuine choice about what they want to be involved in or not involved in. And yeah, we were very much learning as we were going to create safety so that people could express those needs as well. We had some really interesting and open discussions about language when we came to writing the paper. And, you know, some of those discussions were challenging as well. People had strong views about what they considered to be terms that they were comfortable with and not. So that was for us to hold the space then and keep it a safe space to have those discussions, even though it was something that was quite evocative and difficult for people. And thank you very much to Mary for her support in that process as well, because yeah, I think it's really important that we can all have those discussions and come to an agreement about language that feels okay for everybody. And finally, just thinking about communication and feedback, I've probably noted some of these things already under the other topics, but this was really about just making sure we have timely updates, lots of information about the meetings ahead of time. We're really clear about payments and how much time to spend on different activities. We have a lot of clarity around people's roles and their options. And again, thinking about how involvement impacted and what we've done. The other little bit to say about that is that after the interviews, we made sure we had a debrief space for people, especially if you're doing interviews online. It can feel very kind of jarring to suddenly stop and come offline. So we always made sure there was space to talk afterwards about how it went and so on. So just, I suppose, just to summarize, you know, for me, being the main contact for our public members has been without doubt one of the best parts of my job, and also the part where I've learned the most across this study. And it's really switched my perspective about research from focusing on what we do to how we do it, how we treat people, how we make it a fulfilling experience, regardless of the outcome or whether we manage to collect the data or not, and how the relationships that we build are really the foundation of people enjoying this work and wanting to be involved again. So I'm really grateful to have the chance to sort of share some of this learning with you as well. I will now stop sharing my screen and hand over to Tanya to let you know a bit about her perspective on being involved in the research and in RIVA.
So hi everybody, my name is Tanya. I'm part of the RIVA study. I'm here to share my experience with RIVA study. So I started working with RIVA when Kylie gave a presentation about ITFA, which is a domestic violence abuse, about 2 years ago in October. She was actually tell us that they're gonna give training for participants just in case we're interested to give interviews for the domestic violence who experience one. The reason why I joined was because I'm interested and I know some of my friends actually had this experience, so at least I know if somebody need help, I know where to contact, who to contact, and how to help them, even though it's not professionally, but at least I can help them how to get them out from the situation. So RIVA actually gave us practice interview last September, so last year, for about couple of times, but unfortunately the recruitment went not really great. So I'm quite lucky that I interviewed one of the participant in last May. During the training, we did role play and we did practice how to interview participants. It was really great when we had our role play, because it was just a role play. It was just practicing. Everybody, when we're giving questions and they're giving answer yes or no, and they're being friendly basically. But when you encounter the real participant, it's really depend on how the participants was. If let's say they're having a very difficult moment, then it's really hard for you to dig in the answer that we're looking for. But the great thing about RIVA was they're giving us interview script, the procedure on how to do it properly. So we're actually given the care package in a hard copy, so we can actually look up what to ask during the interview. And I'm quite lucky. The first interview was it's not easy, but it's quite helpful, because Jill was there with us during the interview, and the lady was quite chatty. So all the question that I asked, she replied to me by answering completely without me digging down what's if let's say I'm asking them, was ITFA being so helpful, they're not just giving replying by yes and no answer, but really telling us what they did and how ITFA helped throughout their experience. Yeah, so that's my experience on the by interviewing participants. The reason why I'm actually quite grateful being part of FRIFA is not because they're compensating us with obviously I'm actually happy they're compensate us with the fee and everything with us giving our time, but also where I feel appreciated there. It's sometimes it's really small matters, like last Christmas we received Christmas hampers. Although I know it's probably a small things from them, but it's a big thing for me because I don't come from academic background, so I don't have all the doctoral program or everything. I'm just a public member, but being a public member only, I'm still feel appreciated by getting all the things that I need. So even if I need, like now, even if I'm giving presentation for 5 minutes, I'm asking Jill, can you help me with the practice with this presentation? She will give me 15 minutes before everything just to make sure I'm doing it correctly. But yeah, I feel appreciated here being in RIFA study, and I'm so happy. And even now with the giving presentation on the webinar, I thought it will be like 20 participants, but here there's almost 70 participants here, with sometimes with like I don't know, there's no familiar faces because normally I don't talk in big group. I didn't realize there are like 70 here. But yeah, RIFA is always making sure that we'll be in a good hand. So I'm very grateful I'm part of RIFA, although again I don't have any backgrounds or anything. I'm just public member, user member, and helping researchers. But yeah, I feel very appreciated. Thank you so much for this time.
Thank you so much, Tanya, for your reflections, and Jill also taking us through your reflections of the project together, and yeah, sharing your honest approaches and learnings with us. We are going straight over to Rosie and Kane to also give them their 20 minutes.
Great, thank you. So I'm here today with Kane, who is one of our advisory group members, and we're going to give you a bit of background about care experienced young people who our project is working with, and I'll give you a bit of a run through of ADAPT, the kind of nuts and bolts, and then we'll get into what we want to get into and hear Kane's reflections about being part of our advisory group and some of the things that he's been involved in. So over to you, Kane.
Hello, my name's Kane. So with care experienced young people, there's around 80,000 children under local authority care in England. This could be due to being removed from their biological parents and being placed in the care of local authority in placements such as foster care. So, for example, with a family, kinship care, this might be with, for example, like grandparents or like aunties and uncles. Residential care, semi-independent living, and like secure units. The majority are removed due to abuse and neglect or family dysfunction. So stigma, there is a big stigma around like being care experienced and being in the care system, like being in care. So this could be a big stigma is around getting excluded from school, going to prison in later life, people automatically having like severe mental health issues and homelessness. So my experience, so when I was in school, I was excluded, but I feel that sort of came with the stigma. They didn't really listen to like the wider situation. It was very much like the here and now, because, for example, if I had like, the wrong shoes because I might have like moved the night before, and wasn't able to like take everything, often it would be, the clothes that I had on my back. So they wouldn't take that into consideration. Teachers would often tell me that I wouldn't make it anywhere in life because I wasn't like at the required grades, which of course, when you're trying your best going through, being in the care system, generally, like, the issues that teenagers face, let alone being in care, obviously can often like affect your mental health. And then, of course, later in life with mental health issues, it can obviously, for example, if you struggle with mental health, it can often see like that you're not cooperating, which therefore you can be closed from services, which again could impact being homeless.
So I guess then it's, as Kane was saying, it's kind of unsurprising that quite a lot of these young people have mental health difficulties, and PTSD in particular is 12 times higher in these young people when we're doing kind of systematic screening studies. But actually within practice, lots of professionals have the view that PTSD is perhaps not applicable, and actually attachment disorders are more applicable for these young people. So that's kind of the reason we started this project. And we do have good evidence-based treatment for PTSD symptoms. Trauma-focused CBT is what NICE guidelines recommend as the best evidence treatment. But again, in practice, there's lots of views that this kind of treatment is maybe not applicable for these young people, despite research showing that it is effective at reducing their symptoms. And there could be lots of reasons for the barriers to using this treatment in practice, around a lack of support and supervision, concerns around discussing trauma, both from the clinician and the young person's perspective, and different types of psychological orientations that therapists might have. So that's why in ADAPT, we wanted to look at what the barriers and facilitators were for mental health services providing these specific treatments for PTSD. And we also wanted to look at the effectiveness of this treatment for care experienced young people, and to explore how young people actually feel about the treatment, to actually ask them when they've completed it if they thought it was helpful, which surprisingly hasn't been done in the research field so far. So we trained just over 200 mental health professionals in trauma-focused CBT, and these were a range of professionals that would typically see care experienced young people across 11 NHS trusts. And this is kind of the nuts and bolts of the data collection. So we collected data from the service, which was around the numbers of young people they had coming through, whether they were screened for PTSD and whether they were offered the treatment. We also spoke to mental health professionals about their views on the treatment, if they were using it or not. And we did this both through questionnaires and interviews and focus groups. And then we were also aiming to recruit young people who actually are in care and have received the treatment, to measure their mental health symptoms to see if there's an improvement. And as I mentioned, to also just generally ask them about if they thought the treatment was acceptable. So this is the broad project that we were running, and where Kane and other members of the advisory group were helping us mainly around the recruitment of young people in care and involving them in our methods.
So here are a few things. So you can see the highlighted ones are the ones that we just wanted to touch on in a little bit more detail.
Yeah, so these are some of the things that they've advised us on so far.
So with the animations, so we had an animator come along, and we created a storyboard, and we decided to broaden the areas we looked at. So with the animations, we basically decided as a group that, like, how we felt, like, for example, if someone came to us, well, like, what we would want to see and what would make us get involved. So we reviewed them and how they worked for us. So here are some of the pictures. We felt that it was important to, for example, have like the surroundings, and we spoke about, so the surroundings would be, for example, like kind of the state of your mind at that time. I think it's important to sort of show that with your surroundings, because it can be like, that can often reflect your sort of mental health. And we also discussed color blindness. So for example, like some of the colors that went together, maybe that they shouldn't, because for example, I'm colorblind, so I would see potentially a completely different color. So I felt that was important to bring on board, because obviously if I felt that, then many others might.
Yeah, so this QR code as well, I should say, will take you to those animations that our advisory group helped us to make. And these were originally put together to help us recruit young people into the trial. So clinicians that were involved would show these to the young people they're working with. And as this mentioned, there was 4 different videos. We wanted there to be one around what PTSD and trauma-focused CBT was, but our advisory group actually suggested these 2 other ideas which they felt would be helpful for someone about to receive the treatment to see. So that was really invaluable. I also wanted to run through how our advisory group has helped in kind of inform advisors around gaining consent, and that's been a bit of a 2-way street, I would say. So the consent procedures for young people in care are slightly more complex than for other young people, because the local authority holds parental responsibility for that young person in most cases. Although not always, sometimes the parent still holds responsibility, or another adult. So navigating that can be quite complicated. But within our methods, we built in Gillick competency procedures, which meant that we could go to a young person who was 13 plus rather than the typical 16 plus, and enable them to give their own consent. But we had to be quite sensitive around this, and our advisory group was absolutely invaluable in helping us with that sensitivity. But there were also many things that they suggested that we were restricted in doing by ethics and governance around having Gillick competency procedures. Even the simple fact of having it as 13 plus, being quite restricted in that sense. So we had quite a lot of back and forth around this. But the most important thing in our procedures is that we had to have another responsible adult present who could advocate for the young person. And we had to make sure the young person really fully understood what they were consenting to around these 4 key principles. So we went back and forth a little bit with our advisory group about how we should approach this type of conversation, how we can make it more accessible and acceptable for young people. And that included what responsible adult that would be, what options we would give to them for different adults they might want to have involved. Even the simple thing of using the term mental health, we went back and forth a little bit around whether we should say we're going to be asking them about how they're feeling at the moment versus we're going to be asking about what your mental health is like at the moment, and actually using that term. And we decided, based on feedback from the group, that we would use that term because actually lots of teenagers are familiar with that. And it's kind of less stigmatizing for teenagers now than perhaps back in my day. And there were limitations to this. So if we actually needed the young person to repeat these 4 key concepts back to us, and if they couldn't, then we would have to kind of go back a step to some of the other options, or send them some more information and get back in touch. It wasn't the end of the road for them. We still wanted them to have the opportunity, but we had to kind of go back a little bit. And that was important based on the fact that these young people that we were recruiting are very vulnerable. They were really struggling with their mental health at the time because they were in a service as well as being in care. So I think that was an important consideration. And again, our advisory group has just really been invaluable in supporting us in developing making these procedures as good as they can be, I think.
So here is another point that we just wanted to cover. So the future research plans. So adapt the program that we've been working on. So a phase 2 of that. And then there is plans to look at 18 plus mental health. And I think that's really important, because I feel like if we stop now, it's sort of like halfway through. And I think it's important because the ways, like when you're, for example, like 16, 17, 18 is very important to, like, you know, there's so much happening, for example, like the care cliff. And I think like it's important that like there is someone there to be able to like give advice and support, and to like for this to be known. I think it's really important. So I would just like to give some of my reflections. So I think that working with Rosie on this has been, and the other advisory group members, it's been really useful, really important. I've really enjoyed it, and I would just like to say that we've been given, within reason, of course, but like a lot of freedom to sort of, when something's sort of put in front of us, we've sort of, like, of course, some things you have to add because it's the law, or, you know, there's reasons why it has to be there. But it's been very much sort of like, okay, you know, you think that, and then that sort of like really looked at. It's never been where like some things that I've been involved in the past has been like, they sort of have preconceived ideas. And I think it's really good that we haven't had that with Rosie, and that she doesn't do that at all. And we've been able to just sort of, you know, be ourselves and explain. And of course, as others said, when after we've had calls, there's always the options and like processes to be able to, you know, follow up after the meetings. And, or of course, like if we don't want to discuss certain things, then we can also have that like before the meeting. So like throughout, really, which is again really important, as others have explained.
And I'm going to go on to thank you, but I think I also just wanted to add, I guess, that I feel funny that I've brought Kate along to just say that I'm good at doing this. I think it's really helpful having these conversations with our advisory group members, like being able to be reflective like this, because it helps us think about what we can improve as well. I don't think I've always done the best job at explaining all of the restrictions that there are around ethics and governance and finance and things that might stop us doing actually the amazing ideas that they have. But I think what we were saying yesterday came, like the most important thing is, I think, to listen and validate these young people's good ideas, but then kind of try to explain what the limitations are around that, which is sometimes those limitations feel like they shouldn't even be there, and it's frustrating that they're there. But I think helping the young people understand that they're there, and that doesn't make their idea invalid, it just makes it difficult to execute. I think that's been the most important thing. I guess that's an extra reflection from me to add before we wrap up. But yeah, I just wanted to thank and acknowledge our other advisory group members while we were here. and our professional advisory group as well, which has been really instrumental in helping us with the recruitment of mental health professionals as well as young people. And thanks to our core research team, our co-investigators, and I should say our views don't represent NIHR or the arts. And here's our contact details if you wanted to ask us any comments or questions beyond this webinar. So thank you, and thanks for the opportunity for both of us to come along.
Yeah, I would just like to say, yeah, big thank you to Rosie, and yeah, a really big thank you again on behalf of the advisory board, and thank you for everyone here for having us.
No, thank you, Rosie and Kane. Thank you so much for your reflection, sharing your processes and thoughts of how you work together, and how it is a continuous learning process. I think there are lots of, again, applause and thumbs up. So what we're going to do, what Mary and I will do after the 3 webinars, we'll report on what we've heard, on the challenges and the solutions, the resources that have come together. Like I said, we're funded by a large NIHR program, so hopefully it gets heard and seen in many places. And the feedback and the thoughts and the challenges that you have input into the breakout rooms, I've asked the facilitators to take notes so that they can come into the reporting as well. So thank you to everyone for coming. I will quickly post a quick feedback form, online form, if you would be so kind to fill that in if you have a few minutes, just to let us know if you have any suggestions for the further webinars, how this one is going, if we're hitting the spot, and so on. And I'm also going to put in a link to the next one on the 8th of November. Mary, do you want to say anything else?
Just a huge thank you to everyone for coming. We've got some really rich data that we will report on, and I hope you'll all come to the 3rd in the series. And if you've got any further reflections, put them on your feedback form. We really need the feedback forms to know what your thoughts are. So really look forward to seeing you next time.